with AMR has been an asset and a benefit to the community. I remember when it started many years ago, there were a lot of people, what do we need that for? And now they've learned what we need that for. And when our emergency responders are doing 4 calls a day is the average here in town of a town of just under 14,000 people, that's a pretty demanding daily route. So I truly thank you on that. And with that said, I'd like to introduce Michelle from the State Department of Public Health, who will explain the next step.
Thank you, sir. Hello, everyone. My name is Michelle Conley. I'm from the Department of Health. I work for the Office of Emergency Services. And my main position is I'm the Regional EMS Coordinator. And as a side thing I do is the Heartsafe program, which I believe very strongly in. I've been in EMS for 25 years, and I've seen how the movement that this type of program takes has really benefited the town and the community and the citizens. So first I want to say congratulations and commend you guys on the hard work it takes to get this designation for the town of Orange. I am going to give you just a little background, well prepared notes here. I want to thank you guys for the opportunity to present you guys with your designation as a Heartsafe Community. Many of us know that waiting for 911 results in some very long moments, even though it's not that long, it seems like forever. I've been on the other end of it, not just as a responder, but as a person waiting for 911 to respond. And I have to say, I understand where patients are coming from. And when it's something as critical as a cardiac issue or cardiac arrest, it's forever. So this is a wonderful program. People experiencing sudden cardiac events, the Heartsafe program is intended to fill in those long moments while people are standing there waiting for an ambulance and emergency crews to show up. The majority of witnesses to cardiac arrest tend to be bystanders and friends, co-workers, family. With that in mind, it's obvious that the delivery of care immediately by these bystanders is a huge piece to the success of these people's lives being prolonged in these events. Bystanders probably train in CPR in the use of external defibrillators, AEDs, is able to increase the chances of survival and fill in the longest moments by providing care until the emergency units can respond. The Heartsafe Community means that a chain of survival has been established. The chain starts during those moments waiting for emergency care to respond. First part of this program is getting our citizens trained. These are people that are right there witnessing these events and getting AEDs out to the community in public places accessible. Only about 13% of citizens in the state of Connecticut have been determined to actually know what the signs of cardiac arrest and cardiac incidences are. When you think of what a large percent of people are affected by these issues, it's kind of hard to believe that only 13% of the citizens would have even able to recognize the symptoms to these situations. Heartsafe designation doesn't end with the delivery of a certificate and a letter or road signs that you're being presented with. The designation represents a commitment by the town of Orange, continuing to train the public in CPR and AED use, and striving to increase the number of AEDs in our community. I'm happy to be here because this program is something I truly believe in. I'm here because local advocates, like all of you, have taken the steps to increase the chances that their friends, family, and co-workers, and those who live, work, and visit the town of Orange can survive a sudden cardiac event. Designation as a Heartsafe Community represents a true commitment and is not only vital to fire, police, and EMS, but also the various town departments, schools, businesses that provide training opportunities and locations for AEDs to be placed. Most importantly, it recognizes its citizens throughout the community that took the time and effort to take the CPR and AED training, and the people who volunteered lots of time to make sure that this program was put into place and that the training was provided. So with all that said, congratulations, and on behalf of the Department of Health, the Office of Emergency Services, and the American Heart Association, which is our partner in this, I'd like to congratulate Orange and its advocates that put a lot of hard work into this program. So
Thank you very much.
Certificate here to present to the town.
Right, you were a part of the big driver in this. So what are you looking around for?
Me?
You. You should be part of this. You were the driving force beside this.
I have a certificate from the Department of Health recognizing Orange as a Heartsafe designated community for all their efforts and hard work to get that designation. So congratulations. Thank you
so
for
much.
being
Thank you.
our champion here.
Now, what we'd like to know is, by doing all this and having these AEDs, having great staff here, both here, our OVNA are here, our employees, the police department and all, what are the odds of getting a grant fund from the Department of Public Health for one of those thumpers next?
You know, I have not come to a single community that has not asked that question.
Well, I mean, we're working towards that, so that's the
I
next
agree
goal.
with you, yes. Presently, right now, there is no grant money for additional AEDs, but I am constantly looking, not just for the communities, but our program actually operates on zero budget, believe it or not. So
You're going to be negative real soon.
yeah, I'm going to have to start giving back. But I am always looking for those opportunities, and will pass those along to all the communities that have.
We're looking for it.
Yeah.
It is.
Yep. So the more that we
We'll
can
get
get
it
AEDs out there and training, the healthier our citizens will be.
Thank you.
Thank you, everybody.
Thank you.
Okay.
So we have to do the sign, too.
Yes, with the designation, you get 5 signs that you can put up around town. So that, and the great thing about the signs is it promotes questions and conversations for the citizens that haven't yet heard about the program. So it's a great way to keep the
Why don't we
grassroots
get
movement.
my highway public works crew chief up here, and the police chief and assistant chief holding the sign up with us,
Okay, great.
since that's a traffic sign thing. So come on up.
I have a small.
Chief, make sure they use security officers.
One of you on each side, Donnie on one side of it, and one of you on the other, and we're all in it with you, so they can do. There you go. Yep.
Yeah, let's let the AMR guy in here too.
Yeah. See, I have the beauty of it. I'm taller than everybody. Wider too.
It's not behaving well.
Filming it?
There it is.
Check your batteries. Guns count?
Okay.
Fabulous.
Thank you.
These will be going up around town, as you heard the OVNA staff, Maria, Corinne, saying one will be right here in the center of town, and one of these many posts around here, and then locations around the community. The entry signs into the town is a good location, or main streets, and traveled thoroughfares. But we are truly proud to be part of this endeavor. And thank
It
you.
should be. Yeah, currently we have 89 of the 169 communities that have gotten on board and made a commitment. So my goal is to get all of them, but it's going to be a long road.
Yeah, especially with a zero budget.
Yeah.
That's
Yes. I steal money here and there from other things when I need it.
Little town of Bridgewater's got that.
They do.
Yeah.
Imagine that. 12 people and 8 cows. Okay. Thank you.
Thank you, everybody. Thank you.